Medicine in the 1800s by Jared, Julio, and Natalie.
Serious diseases in the 1800s. Diseases such as yellow fever, typhoid fever, typhus, scarlet fever, measles, influenza, and also smallpox are deadly diseases with no cure.
Widow tree bark and meadowsweet. They use widow tree bark and also meadowsweet. The people in the 1800s used this as their medicine. These medicines were used to make the patient comfortable. This medication helped people to not get dehydrated and high fever, while the illnesses ran its natural course.
Leeches. Leeches are worms. Leeches are used to drain fluids from human body. Leeches are also used in medicine in the 1800s. Leeches are good to treat abscesses and tonsillitis. Tonsillitis is an inflammation of two oval-shaped pads in the tissue in the back of the throat. Abscesses is a confined pocket of pus that collects in tissue, organ, or space inside the body.
High fever. If you ever had a fever, you could get your temperatures up to 100.4 Fahrenheit. If the fever is bad, adults and also children get bad symptoms. The symptoms are shivering, shaking, chills, aching muscles and joints or other body aches. More symptoms are headaches and exclusive sweating.
Opium. Opium is a dried latex obtained from the opium poppy. Opium originated in China. Opium is a treatment to relieve pain, coughing, and diarrhea. It was used to induce sleep and give relief to the bowels.
Waterboarding. Hospital used waterboarding, which was a form of shock therapy for mental health disorders. Doctors would hold patients underwater until they lost consciousness. Dunking/showering. They would dunk the patient into the water without warning or shower the patient without warning. They would nearly drown the patient or completely. Broken bones. Doctors would pull the bones back into their place to the best of their ability. After they would then place a splint onto the patient's leg or arm made out of logs or branches and hope for the best. Iron lung. It is a cylinder chamber that covers the patient's entire body excluding the head. This is used to regulate air pressure to help the patient breathe. It was used to gain muscle control necessary for normal breathing that has been lost. Medical instruments. The Liston knife. The Liston knife was to amputate small body parts. The hacksaw. The hacksaw was used to cut into the skull. The tourniquet. It was used to compress the arteries above the cut along an amputation. Bullet probe. The bullet probe was used to detect where the bullet was located in the body. The tip of the probe touches the bullet, and then there would be a smudge of the lead on the tip of the probe, telling the doctor where it was. More medical instruments. The lymphotham. This tool was used to cut into the bladder in order to remove stones. It was a hidden blade that was inserted into the bladder and then released using an aspiring handle. Mouth gag. It was a wooden-shaped screw that doctors would use to insert into the patient's mouth to keep the airway open.